Like, what else can you do once you've experienced a heart attack besides take omegas? Can you do to improve your heart and just
Okay,
recover?
that's a really important question because what we're taught is one aspect of it, and that's what you mentioned, cardiac rehab. And that's to start exercising and start slow and build up and work up and work up. Why? Well, you want to stress the heart. And you're going, wait a minute, I had a heart attack. I don't want to stress the heart. Yes, you do want to stress the heart because things don't repair unless they're stressed. It's kind of like if you break a bone and you put a cast on it and you go around in crutches and you're non-weight bearing, that's okay for a couple of weeks, maybe 3-4 weeks maximum. But if you don't start stressing it, if you don't start putting weight on that bone, it's not going to heal very well.
Hello, hello. Welcome to the Healthy Heart webinar. I was going to show you my book, but I guess I don't have it right there. What did I do with it?
I have mine right
Okay,
here.
good.
Healthy Heart webinar or book. We're on the Healthy Heart webinar about this book.
I love it. There it is, you guys. That's what we were chatting about today. We're going to dig into some stuff, though. It's going to be fun. It's going to be a really good webinar. We already were having a little pre-discussion, and I said, stop, don't say anything else. We need to save that for these guys. So I'm excited to talk about this. We're going to talk about heart attacks. What are they? What are the symptoms? What do you do if you've had a heart attack? All of the things. So feel free to post your questions in the Q&A. Those of you who are joining us on Facebook, you can post those in the comments. This is going to be fun. So before we get started, actually, I'm going to have Dr. Saunders do a quick disclaimer for us.
Okay, so the information that we give here is not for you specifically. It's for general information for a lot of people. And even if you ask the question, that I'm not answering necessarily for you. So it's really important that you apply the information to you specifically with the help of your healthcare provider.
Awesome. And I'm just going to let you know that if you want more information about this webinar or the other webinars that we do, you can go to bartonwebinar.com. It's kind of our hub where you will find all the things that you may have questions about. So hello, Ryan Kelly. Welcome to the webinar. We have Gail from Canada. Awesome. Hello, hello. Okay.
And don't forget to use webinar 25 for a discount. I see those coupon codes coming through. Use them if you haven't already. 25% off an order.
Well, I will type that in here too. bartonwebinar.com code webinar 25. All right. So again, use that Q&A to type your questions. We have Cheryl here from Georgia. Welcome. And we're going to go ahead and get started. So we're going to hand it over to Dr. Saunders. I feel like there's a lot of information out there about what can be a heart attack. Whenever I think of a heart attack, for me personally, I'm always like, if somewhere in my armpit feels strange or my shoulder area gets a weird pain, I'm like, I think this could be it. This could be a heart attack because that's what I've been told. What are the real symptoms of heart attacks?
Okay, the real symptoms of a heart attack are anywhere from nothing at all. A lot of people have heart attacks and don't even know it. They don't even know they may cough, or they may not even have any symptoms at all, and yet their heart is lacking oxygen. So a heart attack, what we consider a heart attack, myocardial infarction. Infarction refers to there's a lack of blood flow or not enough oxygen getting to the muscle of the heart. And if you look at the heart and you see the blood vessels that go to the muscle of the heart, and in some areas there's just one blood vessel going there, and if that blood vessel gets clogged up, and it's clots that form of some kind usually, then all of that muscle that artery goes to is not going to get any food, and that's a heart attack. And so people get like electrocardiograms or echocardiograms, and the cardiologist looking at their heart or looking at their electrocardiogram, EKG, and going, gee, you have evidence that you've had a heart attack in the past. People go, I didn't know that. I've been just fine. I'm still hiking 3 miles a day, and I haven't had any issues. And But some people get the classic symptoms, which is chest pressure, not, well, pain, but not like a stabbing pain. And here's the other thing, it's not stabbing pain, especially if it's on the left or the right. Chest pain on the sides is usually not specific and not important as a rule. Whereas substernal chest pressure pain, like a severe pain that people say, and they don't point with one finger and go, it hurts here. They go, it hurts like this, and like an elephant sitting on my chest. And it goes down in through my left arm. And that, so that's sort of the classic, I can't breathe. That's angina. And angina, it refers to as the heart not getting enough blood flow. And then other things that people have noticed are just shortness of breath or just arm pain. And what's really interesting, what you mentioned of every time you feel, pain in your arm or something, you go, oh, this is it, this is the end. I'm having a heart attack. Because especially in women are more likely to have non-classic symptoms for heart attack, unusual symptoms or different symptoms. Pain on the right arm instead of the left arm, pain in the arm, pain in the back. And so a woman might feel some back pain going, oh man, my back is really sore. And they're having a heart attack, and so it's, there isn't a specific, well, why not? Why isn't there a specific, why doesn't everybody get the same syndrome? It's because the heart has no pain nerves. There's no pain nerves in the heart. Once they crack the chest open and do open heart surgery, the heart itself, you can cut the heart, you can manipulate it, you can do all this stuff. And the heart itself doesn't have pain nerves, but it does have pressure. There is a pressure sense there. And so when people are getting a heart attack, they feel like they say an elephant sitting on my chest, but they can't pinpoint it. It's just like here all over, that kind of thing. So since there's no specific pain nerves, you can't specify where that hurts. And sometimes if it's just like one small area of the heart, then the heart keeps beating. And yeah, this part isn't working well. The rest of it's working well. So you don't get a decrease in blood flow. You don't get shortness of breath, and everything seems to be okay. And you're having a heart attack. So you can't rely on, if someone's not having that substernal chest pressure, an elephant sitting on my chest, radiating down into the left arm. If they're not having it, doesn't mean they're not having a heart attack.
Interesting. So I know that there are all of these set rules for women to get mammograms and pap smears and all of these things. You're supposed to get your colon checked every so often. What are the rules for your heart? I mean, are we supposed to be getting certain tests done after the age of 40? And how often do you go? And what are these tests? Or is that not even a thing?
Yeah. How do you know if you've had a heart attack? And does it matter?
Yeah.
Yeah, it does matter. Yeah, this is important. If you don't know you've had a heart attack and you've had one, that means you've had damage to the heart. And if your heart is damaged, you either have to repair the damage, which the body does repair the damage. But at least what you need to do is say, oh my gosh, I got to prevent this from happening again or being worse or something like that. So for at least prevention and possibly repair, it's important to know. So testing to see if you have any form of heart disease is really important. So here's where the problem lies. How do you test? The classic tests that are done in a doctor's office or by medical doctors do not predict heart disease at all. That's like, if you test your cholesterol, does that predict heart disease? No. No, does not predict heart attacks in the future at all. What about blood pressure? Does that predict heart disease? No, it doesn't. What about an echocardiogram? Does that predict heart disease? Nope. What about a stress echo? where you run on the treadmill, you do the treadmill test, and they go, yeah, your arteries are clean and clear. I've had a couple of patients in 30 years. It's only been a couple, but who have been told their cardiologist did, a stress echo, and everything, all your tests are good, you're perfectly good, and they die of a heart attack like a couple of weeks later. It happens. And so how can you get a perfectly clean bill of health and have a heart attack a couple of weeks later? Well, here's why. It's because the tests that we do are not predictive of anything. They don't predict anything. Cholesterol doesn't predict heart attacks. Blood pressure doesn't predict heart attacks. Echo, all the things that the cardiologist. So
Okay,
what can we do?
Hold on. Do other doctors think that, or just you? Do other doctors know that those tests don't predict, or is that just you?
Well, it's in the literature. If they read the literature, yes, they do believe it's not predictive. And they know that it doesn't predict heart attacks.
Okay. Sorry, I didn't want to interrupt, but I needed to know that.
Yeah.
But they'll do them anyway.
Yeah, that's why I'm so confused. Okay, so what do we do?
What do we do instead? Okay,
Yeah.
So we need to know if there's any possibility of having heart attacks. So we look at things like inflammation. So C-reactive protein, that's something that a doctor might do, C-reactive protein, and sedimentation rate to look at possible inflammation. We look for other sources of inflammation. So if people have gum disease or inflammatory bowel disease or something, we look for that. If people have other problems like osteoporosis or hormonal abnormalities, if they have cortisol problems, adrenal problems, we look for that. And the high adrenals might cause high blood pressure. So high blood pressure could be a marker. So if someone has high blood pressure, their cholesterol's high, what I like to test for is on our list that we talked about, what tests do you do? An important one is the omega-6 to omega-3 ratio. You want it as close to 1 as possible, but at least below 4. If your number is 6 or 8 or 10, I've had people even higher than 10. Where what that means is they have 10 times more omega-6 than omega-3, and you want to bring it to about 4 or 1. Ideally, between 1 and 4 is kind of the perfect place to be. And those are more predictive of having heart disease or dying from a heart attack. And then instead of an echo, an echo is useful, but it doesn't predict heart attacks. And stress echoes, especially in women, they do these in women, and they don't predict really any heart disease at all in women. There is one test that is not predictive, but it does tell you that you have a heart problem or some clotting problem in your coronary arteries, and that is the coronary calcium score. And this is something I use a lot. Because why? Because for me, it's a yes or no question. Either yes, you have calcium deposits in your arteries, which indicate that you have atherosclerosis, and if it's 1 or 3 or 5 and you're 70 years old, okay, big deal. If it's 1 or 3 or 5 and you're 30 years old, that is a big deal. But if you're 70 years old and it's 0, then you don't have heart disease. And so I had somebody come in with blood pressure's high, cholesterol's high. She's on all these medications for prevention of heart disease. And so we did her coronary calcium score and it's 0. And I'm like, you don't have any risks. You don't need that medication. You don't need the other medication. You don't need any of that stuff. You just need to take care of yourself like normal. But she didn't have any risks because that she had a 0 coronary calcium score. That's a really useful test. I found that to be.
Interesting. How do you test people for their omega-6, omega-3 ratio?
Well, what we do is called an omega check. Quest Diagnostics does it, okay. And a lot of other labs do it. And it's really simple. It's really just testing the omega-6 and the omega-3 and then making a ratio. And that's all it is. They have these really intense tests where you can look at all your HDLs and your big fluffy ones and your little skinny ones, and then all of the omega, the DHA, EPA, arachidonic acid, all of PUFAs and HUFAs and all that stuff. But you know what? That's not important. All you need is that ratio. What is your ratio?
Yeah.
Because all the other stuff, like the DHA, EPL, that is made out of your whatever omega-3 you have. And so if you just check the omega-3 to omega-6 to omega-3 ratio and make it as close to 1-to-1 as possible.
So that ratio though, too, I'm just thinking about this because I don't know if I've had mine checked. But couldn't that change day to day?
Yeah, it can change. Well, not day to day. It's kind of months. It changes over months. So depending on your diet. So
like a
you can look
type thing, or not.
A1C.
Yeah.
Yeah. Because actually they are measuring the membranes of red blood cells. That's where they're getting these fats from. And whatever you happen to be eating at the time, that's what your membranes are going to be made out of. So and the cells last for about 3 months in your body. So yeah, over the past 3 months, you're going to kind of see what your omega-6 to omega-3 ratio is.
Interesting. Okay. I know I started writing down a bunch of questions.
Well, we had a friend who she was throwing up in the middle of the night, went to the doctor, she had a heart attack. So it's indigestion, or some people say like heartburn. That's another symptom of a heart attack, or actual,
Yeah, I didn't mention that, but yeah, especially in women, intestinal problems could be a heart attack. Yeah, it doesn't have to be chest.
How does that happen? How does the intestines? How's that related to the heart causing intestinal
blood flow restriction issue to your gut?
No, it's actually from the central nervous system. So the sympathetic nervous system is connected by the vagus nerve to the heart and the intestines at the same time. And that sympathetic nervous system is being overstimulated by this heart attack. And that feeds the intestinal system. So the intestines start contracting, and so you get vomiting and spasms and pain and acid reflux and all that stuff.
Fascinating.
Wow. The body's amazing. Not that we need to say that again, but I feel like every time we talk about this, it's just, I'm surprised. Yeah. Okay. Oh my goodness. Okay, let's dig into this a little bit more. Now, one thing that you did say is that the heart, after a heart attack, it could be repaired. Did I catch that correctly?
Yes. Now that we know about stem cells, this research is amazing, where they have actually tied off arteries to dogs' hearts to let that heart muscle die. And then they open it up and inject stem cells into that area of the heart that has dead muscle, and it rebuilds new muscle. And it's not old muscle; it's new muscle. It's like baby heart, a new, brand spanking new heart kind of thing. Stem cells are awesome; they are just so amazing. So the question of that, we've always been told, when I was in medical school, they said, "No, heart myocardium, it's gone. Once you've killed that heart muscle, it's never coming back." And that's not quite true. You can actually rebuild heart muscle. You can repair the heart, at least to some extent.
Interesting. Okay, we have a Zoom user. It says, that said, when I had my heart attack, I could not breathe. And yes, it was like an elephant was sitting on my chest.
Yeah,
and
that's classic.
And then Doreen says, what is the name of this coronary?
Coronary calcium score.
Oh, yes.
That's all it is. Coronary calcium score. So it's a CT scan. It's a CAT scan, and it looks for. It does a 3D image of the heart, but since calcium absorbs X-rays really well, then they can actually determine the exact amount of calcium that is in those blood vessels of the heart.
Okay, we did talk about omegas, oils, fats on our webinar last week, But Cheryl says, do you recommend taking fish oil, omega-6 and or omega-3 supplements?
Okay, omega-3 supplements. Okay, here was the issue we discussed, and we should repeat this. It's easy to get omega-6. You need omega-6. You have to have it. Without it, your immune system can't function. You really need omega-6. But every oil has omega-6. You can't avoid it. Coconut oil has omega-6. Olive oil has omega-6. All avocado oil has omega-6. Everything, every nut, every seed, every oil you have has omega-6. So you can't avoid it. So you don't need to take extra omega-6. What you need is omega-3 because it has to balance. So in the United States, we get an average of about 6 to 1, 6 times more omega-6 than omega-3. And it should be ideally about 1 to 1. And at least if it's below 4 to 1, that gives you a better ratio, less inflammation. So the more omega-6 you have, the more inflammation you have. The more omega-3 you have, the more it keeps the inflammation from causing problems.
I wanted to ask about the coronary calcium score, because you'd mentioned 135. Like if someone in their 70s had that, it was not a concern. But if someone in the 30s had that, what a score should we aim for?
0. You want 0. You want none at all. And so what's happening is in the arteries, you have that lining of the arteries called the glycocalyx, part of that endothelium that allows the blood to just flow so easily through the arteries. And then you get a damage to that lining, and then it forms a clot on there. And then the body paves over that, and you have this clot on the inside. And if the clot dissolves, it's gone. You have nothing there. But if it organizes means the clot is still there. It just becomes a protein tissue, and it just stays there. And so you have this like little lump inside of your in your artery in the wall. It's in the wall of the artery, and what happens when it organizes, because of the inflammation, it'll deposit calcium in there. And so this test, the CAT scan, looks for calcium deposits, because normally there's no calcium deposit. There should be none in your arteries at all. So wherever there's calcium deposits, it's very likely that that's an organized clot. There are other reasons, but that's likely. You know, what's interesting, if any of you have ever been on Coumadin or warfarin, Coumadin or warfarin is an inhibitor of vitamin K. Vitamin K takes calcium out of your soft tissues and puts it in your bones. And so if you're taking warfarin or Coumadin to prevent clotting, then what happens is you can take calcium out of soft tissues and put it into bones. You start depositing calcium in your soft tissues. So without ever having any clots, you get all this calcium buildup in all of your arteries. I have a patient right now who is on Coumadin for 20 years, and he's had 3 bypasses in his legs. He's just when you take an X-ray, every single one of his arteries is visible because there's calcium deposits in all the arteries. It's just crazy from being on Coumadin for a long time. So there's a big disadvantage of long-term warfarin therapy to prevent clotting.
Okay, and I think you just mentioned this a little bit. Aubrey says, if you have calcium in your arteries, how do you get rid of it?
Excellent question. Vitamin K2 has been shown to take calcium out of the soft tissues and put it in the bones. So getting not just adequate amounts of vitamin K2, but taking extra. In fact, Life Extension has a vitamin K2 that I think is 45 milligrams. So if you think of the normal amount as 45 micrograms, this is 1,000 times more than your adequate normal dose. And so it's really a pharmacologic dose. But that pharmacologic dose, as long as you have enough vitamin D3, that pharmacologic dose will start taking the calcium deposits out of arteries and putting it in the bones. That patient I was telling you about, that's what we did. We put them on that.
So, okay, so you need to take the D3 with it. How much D3? And then are there any side effects to taking too much K alone then?
Probably there are no side effects of taking vitamin K, and there's no known toxicity of vitamin K. K2, MK7 is the one. Let's see. And then vitamin D3, you asked how much vitamin D3. About 10,000 units a day is an adequate dose of vitamin D3. Some people take the 50,000 unit, and that's the prescription dose is 50,000 units once a week. That's okay too.
Okay. Nikki had asked about the coronary calcium score. We kind of talked a little bit about how that works. It's kind of over time, maybe about a month that it stays in a similar range. But she's asking, can her score be changed?
Yes, it absolutely changes. And if you think about it, what we were talking about is that you're measuring the membranes. The membranes are made of fats, right? So you're measuring the fats or the membranes of the red blood cells. Red blood cells last for about 3 months. So whatever you're eating today will be deposited in your red blood cells and become part of the membranes of those red blood cells. And then tomorrow, the next day, the next day. So over the next 3 months, you can completely change your omega-6 to omega-3 ratio. Okay,
and since we're talking about that, I want to go ahead and share my screen with you guys and show you. I have to show everybody this beautiful bottle here every once in a while. But here's our new omega-3, and it's just beautiful. But I actually got my hands on some of this, so I'm really excited about it. If you want some of this for yourself, you can go to bartonnutrition.com. Check out that pretty little bottle. But notice it's omega-3s. It doesn't say omega-9 or 6 in there, just like Dr. Saunders had talked about. I don't think, what I believe Dr. Saunders says is we don't probably need any help getting those other omegas. I think especially here, probably with our American diet, maybe not everyone's that way, most people. But so the omega-3s are really what we need to help balance those. So if you're interested in that, bartonnutrition.com, guys, use code webinar25 and you'll save 25% on these. And now it says to take 2 soft gels a day, anytime, preferably with a meal. Anything else you want to share about that, Dr. Saunders?
Yeah, with a meal, because it's a fat and needs to be absorbed with the fat. So ideally, if you have a gallbladder, the gallbladder secretes the bile that helps you absorb those fats. So that's why with a meal. That's what I was going to say.
I heard you.
What? Go ahead.
Go ahead.
The omega-3 is a supplement, and I think it's a good idea for Americans because we have a hard time getting omega-3s. If you're eating a lot of flax seeds, then you probably don't need this supplement because that is a supplement too. You get 2 grams of omega-3 in every tablespoon of flax seeds. So there are other options, but Americans should supplement some omega-3 because all of our other oils are mostly omega-6 and very little omega-3. So the balance is always going to be off.
Where else can you get omega-3?
Flax seeds, chia seeds, fish, seaweed, vegetables. If you eat a cup of broccoli, for example, you get about 100 milligrams of omega-3, and it's a 10-to-1 ratio where you have 10 times more omega-3 than omega-6. So vegetables, generally, all the green vegetables, they're higher in omega-3 than omega-6 as a rule. Not all of them. So people that are on like vegan diets, they tend to get omega-3s pretty easily. They're getting tiny amounts, but their ratio is good. That's the key. Yeah.
I mean, this supplement here is 1,200 milligrams. So we're talking 1 cup of broccoli is 100 milligrams. So you're going to have a lot of broccoli seaweed sandwiches in order to get the correct amount of omega-3, guys. So actually, my kids love seaweed. It's very strange. I keep finding it in their rooms. They eat, or the kelp, I guess, or whatever it is. But
Those chips.
yeah, well, in the little, not the chips, the actual, you can get them at like Costco in the little plastic tubs.
Yeah. Those
Squares.
seaweed. Yeah, seaweed squares.
I was
you get. Go ahead.
No, I was going to say one of the things we do at Barton is we're very proud of our supplements, and because we strive for high quality and we test them, we test for purity. And one of the reasons we love this omega is because it's sourced, I believe, in the Nordic areas. And so, Dr. Saunders, why is that important to get fish from that part of the world?
A couple of reasons. One is it's the northern cold waters, the cold water fish, mackerel, sardines, salmon, that have significantly more of the omega-3 than omega-6. The other part is it's actually less polluted than southern climates or towards the equator. So there it tends to be cleaner, and it tends to be have less of the PBs and heavy metals and stuff like that.
Since we're all on here, you should give us a quick lesson in farm raised fish. Like when we go to Costco, grab, or do we want farm raised fish?
Okay.
Versus
there is a big difference. So if you take salmon, for example, that's raised on a farm, it does have more omega-3 than omega-6. It's about 4-to-1, so 4 times more omega-3 than omega-6. But if you get a wild-caught salmon, it's 12-to-1. So it's significantly more omega-3 to omega-6 ratio in a wild-caught salmon than in a farm-raised salmon. So the farm-raised salmon is not bad. And in fact, if you compare it to things like beef and lamb and all those and all the terrestrial animals, it still has much more omega-3, a better omega-3 to 6 ratio and all of that. So it's a better choice. But even better if you get the wild caught.
And that's because of what they are eating, correct?
Correct. The farm raised fish, they're fed pellets that are fish meal, corn, soy, and the corn and soy have a lot of omega-6 in them. So that kind of lowers their omega-6 to omega-3 ratio.
Very interesting. There you go. See, isn't it fun to learn these things? All right. Okay, question here. Zoom user is asking about blood pressure. It says, my blood pressure is good, but I remember Dr. Saunders saying that if your pulse is high, there could be another problem. Mine is 85 to 98 a lot. Is that something to worry about?
It might be. You might look at why that is. Why is the pulse elevated? There are a lot of different reasons. You could be just dehydrated and just lacking in sodium. If you're not getting enough sodium, you're going to have a higher heart rate because you don't have enough blood volume to go around. So you have to pump more often to get it around. Another reason might be the heart itself. And what I was talking about before, if your heart rate's fast, that if you have an ejection fraction of your heart that's only 50%, which is technically normal, then it's going to have to beat faster than somebody who has a 70%, where they're pumping more of the blood out each time. Or if you have a smaller heart, people who work out in gyms of bodybuilders tend to have small, thick hearts, and they beat really hard, and they tend to beat faster. Whereas somebody who's a marathon runner or ultra marathons or triathlete or decathlete, those guys have big hearts that just go like they beat every 30 times a minute, every half second. So beating faster could mean a really strong heart, for example, could beat faster. On the other hand, it could mean something else, that it's not getting enough, there's not enough blood flow, for example.
So what would you do to find that out exactly?
Okay. That's a really good question.
It's a lot.
Start out with the simple things. So if it's dehydration, you'll tend to stand up and get dizziness. And if you get that kind of a symptom, like every time I stand up, I have to hold on to something because I have to wait a second because of dizziness. That usually means you're dehydrated and maybe not getting enough salt. So you might want to increase your salt if that's the case. If it's a persistent problem or there may be something wrong, you can test and look at your electrolytes. The other kinds of tests that you could do would be an echocardiogram that have the, say, just from a rapid pulse, rapid heartbeat, and your cardiologist might want to do an echo to look at, are your valves working properly? Is your heart ejection fraction good? That kind of thing.
Okay. Cheryl asked, I'm taking a good whole food multivitamin. Do I need additional supplements?
Probably not. Eat good food, get your nutrients from food. That's kind of an ideal thing. It's not that the purpose for supplements is to supplement. And in the United States, there are 3 things that we cannot get from food reasonably. And that is selenium. So that's a lot of people are deficient in selenium. Vitamin D, well, vitamin D is not found in any food unless you're drinking cod liver oil or eating livers or something. Vitamin D, what's the other one?
Chromium?
Chromium.
Maybe.
Is that the one? No, iodine. Chromium you can get from food, but you have to eat a lot of fruit, vegetables, and nuts and seeds. Iodine, you can't get iodine from food unless you're eating seaweed, because in the United States, we don't have iodine in the soil. They test people periodically. 10 years ago, they looked at young girls, high school girls in Midwest, and 12% of them had goiter, enlarged thyroid gland, from a deficiency of iodine. That's pretty significant, when a 10th of the population already has it in high school.
Wow. Very interesting. Okay.
Can you give some more examples of what to do after a heart attack to help recover? I hear people going to cardiac rehab. Is that helpful? Or is what else can you do once you've experienced a heart attack besides take omegas? Can you do to improve your heart?
Okay, that's a really important question, because what we're taught is one aspect of it, and that's what you mentioned, cardiac rehab. And that's to start exercising and start slow and build up and work up and work up. Why? Well, you want to stress the heart. And you're going, wait a minute, I had a heart attack. I don't want to stress the heart. Yes, you do want to stress the heart, because things don't repair unless they're stressed. It's kind of like if you break a bone and you put a cast on it and you go around in crutches and you're non-weight bearing, that's okay for a couple of weeks, maybe 3-4 weeks maximum. But if you don't start stressing it, if you don't start putting weight on that bone, it's not going to heal very well. It's not going to heal right. The heart's the same way. So yeah, at first you're very light and you're very careful, and then you build up and build up and build up over time, because you want to rebuild that muscle. You want the stem cells to come out. So then the next question, well, we just barely peeked into like the dogs where they injected stem cells and that grew a new heart. It was like all new cells and everything. It was awesome. So how do you get that? Do we have to go into the cannula and inject stem cells into your heart artery to get that? No, you don't. We all have stem cells in our heart already. We already have heart stem cells there. And so all we need to do is activate them. So the question is how to activate them. And that's where you become anabolic. Mm-hmm. And anabolic is when you're fasting and you make a hormone called ghrelin, which is growth hormone releasing hormone. You release growth hormone, human growth hormone, HGH, stimulates the repair of everything in the body, whatever's going on. And you can do that every single night with the 610 reset program. Go on to our bartonwebinar.com and look up 610 reset, and you'll get what we talk about. That means no food after 6, and go to sleep by 10 o'clock, because what that does is that going to bed with an empty stomach allows you to make that human growth hormone and get that anabolic repair and start those stem cells working. A lot of people, they get like stem cell therapy. I had a woman spend $20,000 going to somewhere in the Caribbean, I don't know, Trinidad or something like that, and to get the stem cell injections into her body, because they use her own stem cells, actually take that out of her body and take the stem cells out and use her own stem cells. And that's the point. We all have the stem cells, but what they never did is they never activated the stem cells. So she's laying there thinking passively she's just going to get the stem cells injected into her, and it's just going to go to where it needs to go and fix things, without having the human growth hormone and the ghrelin and the melatonin and all the anabolic hormones that are needed for initiating that repair system so that the stem cells work and actually do the repair. So that's the next, that's really important for cardiac rehab is yes, the exercise is essential. Getting the right nutrients is essential. So you got to get the nutrients that we have: coenzyme Q10, L-carnitine, especially magnesium, D-ribose, getting the nutrients, and then eating well, and then the 610 reset. And those are the things that you do for cardiac rehab.
All right, got to share my screen one more time. Are you guys seeing that? Just want to make sure I got the right thing. Do you see it?
Yes, I
Fiber
see it.
greens, omega-3.
All right, I'm going to show you this healthy heart support. There we go. It wasn't loading. I was like, wait a minute, I don't know what the ingredients are, but look at that. Okay, so Tal, you mentioned some of these. So there's the L-carnitine, the beetroot, ashwagandha, olive leaf extract, and coenzyme Q10. So those are some of the things that he just talked about are in the supplement. So this says to take 4 capsules once per day. Is this something that you would take preventatively?
You could, absolutely. So one of the things that having a healthy heart requires is less stress. So we put like ashwagandha in there, helps to decrease the adrenal hormones, the stress hormones that cause excessive stress on the heart. And then the beetroot helps to make more nitric oxide that dilates the blood vessels and allows good blood flow. Okay, so that's something we haven't dealt with yet. What's the other reason for heart attacks? We talked about the clots, right? The clotting up the artery, but we didn't talk about the other reason for a heart attack, which is probably, some estimates, 60% of heart attacks are constriction of blood vessels. So you have this blood vessel that's perfectly normal, everything's functioning, and all of a sudden it has muscles in it, right? And the nervous system from the brain tells it to constrict, and it constricts and just keeps going and shuts off the blood flow. So you don't have any blood flow going to that area of the heart. And there's no clot in there. All it is a constriction of blood flow. And it's called Prinzmetal's angina. And the way it's treated is with nitroglycerin. If you have people taking nitroglycerin, you ever heard of that? I remember as a kid, my grandfather had nitroglycerin tablets, and I'm like, really? Could we like take a hammer and blow them up? Explode the pills? You know, that's little boy thinking, right? And no, that wouldn't work, by the way. So just in case any of you had the idea. The nitroglycerin provides nitric oxide for the dilation of blood vessels. That's all it does. It dilates blood vessels. So what's happening is the blood vessels constrict, stop the blood flow to the heart. You get this terrible angina, chest pain, I can't breathe, and all of that, as if you're having a heart attack. You are having a heart attack. But your heart attack is caused by your own body just closing the blood vessel. Your brain is actually just shutting down the blood vessel. And that's a really dangerous thing, because it's been known there's something called Takotsubo syndrome, which was found in Japan. And the Takotsubo is a trap that they use to trap octopus. And it's kind of a weird shape. And the reason it came about is because when they were looking at the hearts of these women that were having heart attacks, their hearts were very oddly shaped and they looked like a Takotsubo. And that's because like one of the blood vessels is just closed down. That's all it is. It's just closing of the artery. And so the heart is beating, but part of it is not beating. So it takes a weird shape because part of it stays not beating while the rest of it does beat. So it looks like, a balloon that has been pushed in on one side and bulging out on the other side. So that Prinzmetal's angina, and that can be a full-on heart attack. And there was a really surprising thing of when in New York, a hospital in New York said, we're going to be the cardiology hospital. We're going to have a cardiologist there 24 hours a day. So if there's any heart attacks in the city of New York, everybody, you've got to come to this hospital and we're going to take care of you immediately. We're going to have the cath lab available. We're going to be able to do stents, whatever you need. So when someone's having a heart attack, come here. You know what they found? 60% of heart attacks were constriction of blood vessels, not clots. That only about 40% of them were clots and 60% of them were constriction of blood vessels. So it's common. It's not a small thing. So then that begs the question then, how do you stop that? And that's where the supplement that you were just showing us has, why does it have ashwagandha and beetroot? Well, ashwagandha decreases stress. Beetroot gives nitric oxide to dilate blood vessels. It's kind of like having a shot of nitroglycerin. So that's why we have those in there. So we have two different things. That's why that supplement was made, because we couldn't find anything like that was going to work on both types of heart disease.
Wow, very interesting. This is good stuff. So Bonnie had sent a message that says, I woke up with mild chest discomfort one morning, went to the ER, and my PA made me wait 4 hours to repeat troponin numbers again, and they were slightly elevated. I was sent to a bigger hospital. They did an angiogram, and they said that I had broken heart syndrome. So what is that?
Broken heart syndrome is Prinzmetal's angina. That's where one of your blood vessels closes down. And Takotsubo syndrome is also called broken heart syndrome, yeah. And what it means is that your brain, and that comes from your limbic system. So this is from your emotions. Your emotions control your autonomic nervous system that controls the blood flow to every inch of your body. And so this is an emotional problem, and it's a stress-induced problem. And so, yeah, we have this beetroot to increase the nitric oxide, but that doesn't deal with the problem of the broken heart. So yes, people do get that. That's not uncommon. In fact, if you look at statistics for heart attacks, the least likely time to have a heart attack, the least likely hour of the week to have a heart attack is Friday afternoon. The most likely hour to have a heart attack is Monday early morning, like 4, 5, 6 o'clock in the morning.
Wow.
Isn't that weird?
Mm-hmm.
Wow. Very, very interesting.
Then that part is the emotional part.
Yeah.
Broken heart attack.
Wow, guys, this was a lot. This is very good. I think, let me see here. We got a couple more questions. Question from Seydu. My wife has a low blood pressure between 98 and 60 to 100 over 68. Oh, I read that wrong. Between 98 over 60 to 100 over 68 all the time. Can you please advise me? Do you think that's too low?
Okay. It might be too low. It might not be too low, depending on age. Blood pressure that low in a younger age woman is actually pretty normal. And so the number is less important. And what's really important is if she's getting dizziness, like when she stands up and she has to hold on to something because she's feeling off balance or dizzy or lightheaded, then that's an indication that her blood pressure is too low. And you can often help that just by adding salt to the diet, like having just adding salt. Use a salt shaker, or some people put pinches of salt in their water and drink it and stuff like that. But getting enough salt is often helpful if that's the case. But if she's not having any symptoms, then that number is a fine number. 100 over 60 is like, okay, that's good. Women tend to have lower blood pressures when they're younger because they make a lot of progesterone, and progesterone is a muscle relaxant for smooth muscle, which is what the blood vessels are. They're smooth muscles, so they tend to be relaxed by the high levels of progesterone. So that's it's common for women to have lower blood pressure.
Okay. Tell us the name again of the octopus thing. Eric wanted another description, but I'm like, you know what, we get the name of it, we can Google it too.
It's Takotsubo, TAKUTSUBO.
I looked it up. TAKOTSUBO. TAKOTSUBO. If anyone's looking that up.
Very
now.
interesting. Maybe you can post that in the chat, Cheryl. Can you post that in the chat? Okay, perfect. Let's see. We have Cedric said, I'm experiencing shortness of breath and find that with some level of exertion, I experience shortness of breath. I do have an appointment scheduled with a cardiologist tomorrow. EKGs did not reveal a heart attack, and a recent chest x-ray did not reveal any issues. As far as vitamins concerned, I'm taking Centrum 50 for older adults. So this is something that we just kind of talked about at the beginning. I don't know if you were on, Cedric, but a lot of the tests that you do don't often show that. So maybe you can chat a little bit about that again, Dr. Saunders, and maybe go through those tests that you would recommend.
Yeah, okay, let's talk about that specifically, shortness of breath, because that is a symptom of a heart problem. And it could be a symptom of not having a heart attack necessarily, but it could be a symptom of heart failure of some kind. So sometimes the valve doesn't work right. Sometimes there's a hole in the heart, between the ventricles or the atria. There's a hole, and that lets the blood through. Or sometimes the valves don't work right. I already said that. Or sometimes the heart just isn't beating very well. That you have an ejection fraction of 30%, or dilation. It's not dilating very well because you don't have enough energy. So there's a lot of different reasons why you might have a heart problem that causes shortness of breath. And so not having a heart attack doesn't mean you don't have a heart problem. It means you need to look further and find out why. And the other issue is that that you could be having shortness of breath for lung problems. It could be a lung issue that you are not getting enough air, especially because it happens with exercise. And why not? Well, there could be fluid in the lungs. There could be bronchiectasis of some kind. There could be fibrosis of the lungs. So all of these things might be related to having shortness of breath when you exercise. Don't just do one test and say, oh, it's nothing, and blow it off. Don't blow it off. This is important, because if it's several of these underlying causes, you can deal with it early and not end up on, having to carry an oxygen tank around with you. It's important.
Sure.
Nikki says, this has been amazing. Thank you so much. Yes.
Oh, thank you.
Okay, Dr. Saunders, I think that's it for today. Thank you so much. Go bless your patient.
Okay.
See you next week.
Okay, bye.
All right. So for the rest of you guys, thank you again for hanging out with us. Come back next week. We have 2 webinars that we do each week. Wednesdays, we do our type 2 diabetes focus webinar, and that is at 1 p.m. Central Time. And then, of course, Thursdays, we have our Healthy Heart webinar, but you can register for both of those at bartonwebinar.com. They are free webinars. And you will also find all sorts of information on that site, link to our YouTube channel, top questions that are asked, supplements, solution kits, just a lot of information. So I'd really encourage you to go there. If you thought of questions today, I would encourage you to go to the YouTube channel. You'll probably find answers for most of them. If not, bring your question next week. We'll do our best to get to as many of those as possible.
Do we have a topic for next week?
We don't. We
All
went
right.
through a whole list, so we got to kind of revisit some of our topics. So
It was good.
It was good. This was a great topic. Thank you. Thank you, Cheryl, for your help in doing this. This is
Wonderful.
fun. Yes. We'll see you guys next week.
Bye.
Invite a friend. Bye-bye.